introduce Kevin, Ariyo, and a carer, Ajibola Lewis, Mrs. Ajibola Lewis, the mother of Seni Lewis, who is tirelessly working that others don't experience the very tragic experience she had. So Kevin and Aji, the floor is yours. Thank you.
Thank you very much for inviting me. I feel a bit of an outsider. I think I must be the only person who probably isn't a professional psychiatrist or social worker. My son, I won't take long because I know we're running late, and I want Kevin to share more about Seni's law and the focus groups that we've done, and the guidance and the consultation, because that's really important, because that's going to affect everybody. It's a law and it's coming into effect, and everybody is going to be involved in implementing it. Just a little bit about Seni. We call him our gentle giant, our shining star. He was 23, just finished his master's and was going to do his PhD. He went out. We don't know who with, because by the time I wanted to ask him, he was dead. But anyway, he went out, came back and said, "Mom, they've given me something bad, or I've taken something bad." And I was anxious, and then he says, "Oh, it's okay," because he knew I get worried quite easily. So this was the August bank holiday in 2010. So over the holiday, he got quite agitated, unsettled, and he knew that something was wrong. We all knew something was wrong. And eventually he decided to take himself to A&E. So his father, myself, and his best friend, we went with him. He didn't settle in A&E. He walked out, the police were called, but they were very gentle, really. And they said that the best thing would be to take him to the 136 suite at the Maudsley Hospital, which is opposite King's College Hospital. So he was taken there. He walked out of there, walked onto the Herne Hill train station. They weren't sure whether to turn off the electric. They thought he might jump. They weren't sure. But eventually the police were called, and they exhibited really good police practice. They de-escalated the situation. They took their jackets off, they got down at a level, he was sitting on the bench, and talked to him. And eventually they persuaded him to come back. So he went back. Eventually in the evening, we were told that it would be better for him to go as a voluntary patient to the Bethlem Hospital in South London. So I took him, and when we got there, I just thought, this place is very noisy. It's not conducive to anybody who's not feeling well. But that was where we were told to bring him. Eventually at 8:30, we left. Yes, he was a voluntary patient. They would call me, took my number again, and we went out. And I wasn't feeling easy. And I told my eldest daughter, "I'm going to sleep in the car park. I don't feel good." But she said, "Mom, you've been tired, come home. They'll call you. They've got your number. They said they'll call you." So I went home. About 10:30, his best friend called to say, "Mom, have you realized that there's been an incident?" "What incident?" They hadn't called me. So I called them. "Yes, go to A&E. I'm going very quickly. Sorry, because I only want to take a few minutes." So we went to A&E, and he was on life support. We didn't know what had happened. And it was the Evening Standard who came to the door one day and said, "Do you know what's happened to your son?" "No." "Okay, we're going to run a story. We've had a whistleblower. We're going to run a story." And that's how we knew what had happened. Apparently, when we left, Seni wasn't settled. He wanted to come home. But instead of calling me, they called the police. And eventually 11 police officers were called, and they restrained Seni. They took him from the ward, which was on the first floor, down to the ground floor to the seclusion suite. But when he got there, he sort of knew what it was. He'd been in the 136 suite before. that morning. So he put his hands up to stop them taking him into the room, but they pushed him. He fell on the ground. Then they tried to do what they call a cell extraction, which what they do in a prison cell. And that means that you restrain the person and then you try and get out. But Seni was quite fit, 23-year-old, you know, into sports, and he got up before they did and made it to the door. But they battened him and pushed him back. Then they restrained him in 2 sets of hand restraints, one across his chin and one at the back. I'm not sure if you can see, and 2 sets of leg braces in a prone position on the floor, restrained for over 45 minutes in 2 sets of restraint. And at the inquest, they said, oh, we were so tired. We had to call for water. We got hot. And the coroner said, what about the person that you were restraining? Did you think about them? But obviously not. Eventually, after restraining Seni, his body went limp. And instead of giving him CPR, they left him. They thought he was pretending, faking it. So they left him. Left the room, the door locked, had to find the key, got back in, did CPR. In the meantime, a doctor and nurses were watching from outside, unable or unwilling to help. Seni was resuscitated, put on life support, but of course, he was brain dead. So we switched off the life support machine. It took us 7 years to get an inquest. 7 years to get an inquest. But we were very, very fortunate with the jury. And they found that Seni had died as a result of excessive, unreasonable, disproportionate force and restraint. And it was after that that our MP wanted to make a lasting legacy for Seni, that we got Seni's law. Thank you, Dr. Agre, for mentioning Seni's law. Kevin will speak to that after, but I just want to say a few things. Please, you're Black psychiatrists. You have a mother, a father, a brother, could be even you yourself, because I know amongst mental health staff, there are a lot of mental health issues. It could be anybody. Think of the person. Step back, de-escalate, think out of the box, get to know the person you're dealing with. Please try not to call the police, because the police have no idea. They are not mental health practitioners. You are. Please refrain from prone restraint. Please do not use restrictive practices. We know this goes on, because since I've had, you know, I've lost my son, I do a lot of talk. I talk to anybody abroad, in England, Wales, Ireland, Scotland. I talk to people, a lot of NHS trusts. I know what goes on. You're dealing with a human being. For goodness sake, step back and think. And when you see something happening, do something about it. Stop it. I wouldn't like what happened to my son to happen to any other person. And don't think that because you were not involved, or because maybe you didn't take action, that you are free from the karma. It doesn't work like that. I'm a Christian. What goes out, comes round. We know that. For goodness sake, people, be aware of what's happening. I'd just like to say a couple more things, please. I love quotes. And James Baldwin said, not everything that is faced can be changed, but nothing can be changed unless it's faced. Let's do something. Nelson Mandela, it always seems impossible until it's done. It is. I never thought we would get this far. I never thought we would get a law on the statute books, but we did it so quickly. And it's going to be implemented. Let's start changing the world for a better place. We do it daily, no matter how small our actions are. You may think it doesn't matter what you do, but it does. It comes back. It comes back. And let our choices reflect our hopes and not our fears. Thank you very much. Kevin.
Yeah, thank you so much, Aji. Yeah, you just speak.
And you're going
Sorry, Chinwe.
come in. So this heartwarming story, I mean, heartbreaking story, it will stay with us. A lot of us are clinicians, and this is, it's heartbreaking, just even thinking about. And I want to assure you that for us here, we will not forget but your work and Seni. Thank you. Kevin, do you want to?
Yeah, sure. Can you see my screen okay? Yeah, so my name is Kevin and I'm a PhD student at King's College London. And I'll be speaking to Seni's Law and some of the projects that we've been involved in over the past year to try and implement Seni's Law as effectively as possible to obviously make sure to try and prevent things like this from happening again. I'll start by saying that the Mental Health Unit's Use of Force Act is a new piece of national legislation. It was put forward by a Labour MP called Steve Reed in response to the death of one of his constituents due to excessive use of force while he was having a mental health crisis. That constituent was Seni Lewis, and to honour his legacy, the act is widely known as Seni's Law. The main focus of the law is, first of all, to reduce the use of restraint in mental health patients and to train staff in alternative ways of keeping them safe. There will be provisions to make services accountable for this, and there are various policies designed to improve transparency in every trust. For example, there will be a named person who will be accountable for the local policy in every local area. And that person will report back to the Secretary of State for an annual review. And finally, there's a provision for all police in mental health units to be using body-worn cameras as well. And I just wanted to go into detail in a couple of those sections that I outlined. So in South London Maudsley or SLAM, there's already a line of work in anticipation of Seni's Law. One of the things that SLAM will be doing is co-producing a course with Aji Lewis called Seni's Story to try and give insight into the real impacts these events have on families and local communities. SLAM will also review their clinical training. There's been engagement with stakeholder groups such as current staff and trainers, but also people with lived experience such as Aji and Marcia Rigg, their carers, community members, and other stakeholders. And there have been visits to other trusts to share best practice. And we're hopeful that by inviting all of these different perspectives and sharing these stories, we can really bring something different and to empower staff to challenge cultures that lead to restrictive practice. So, for example, in Seni's case, he was restrained by up to 11 police officers before he died. And we really feel that there's a need to empower staff to challenge bad practice like that when it arises. And we really feel there's a need to look at interactions between clinicians and the police in those high pressure situations. And there are two sides of Seni's Law policy on information. So of course, it's important to have a means to collect information, and Sam's presentation, I think, spoke to that. But we also think there needs to be a lot of thought into the information that's given to families and carers and people with lived experience. We know that in many cases, there's mistrust between services and local communities, and we would like information to be framed in a way that supports people with lived experience and their carers to be as involved as possible. The key question, I feel, is how do we provide information around restrictive practice and care in general to people in the community? I think it means both working with people who have never been in the system, but also working with people who have been in the system. And I'll speak in a minute about some of the focus groups that we've been doing. But we also have to think about the impact of communicating our practices. And I think this means being open to being challenged and having to reflect on why it is that we might see things differently. It reminds us of the impact of restraints of families, even when the practices might be considered necessary. And overall, we just think that having this dialogue will bring us much closer to the people we're trying to support and the organizations who are already supporting them. And now just a quick run through of the focus groups. So I volunteer with a charity of Black mental health staff called Colourful Minds. And we wanted to feed into the statutory guidance for Seni's law. We felt this was really important to get right because it will have a huge bearing on how professionals interpret Seni's law. We were also aware going into this work that Black people in the UK are more likely to be restrained, detained, and to have police involvements relative to white people. You can see more information on that in the Angelini report, for example. And we weren't confident with the current approach that the voices of those marginalized people would truly be heard. So we set up 2 diverse focus groups, one with people with lived experience of restraint and one with staff who had worked on wards. And we spent 2.5 hours in each just scrutinizing the guidance to really make sure that we were getting at all of the issues. And I won't have time to give a full overview, but I'll give a link to the final report. But in general, we found that the patients and staff members were really aligned in their views when we asked whether there was a culture of use of force to get patients to comply. So in other words, if use of force was used coercively, 100% of the people with lived experience agreed or strongly agreed that that was the case. And 75% of our focus group of staff also agree that that was the case. So the complexity wasn't in getting people to agree. It was more in figuring out the wide range of issues that we need to combat in order to reduce restrictive practice. And I've outlined some of those here. So both groups are quite optimistic that change is possible, but the pessimism was more around the fact that not a lot of change has been done previously. There was a real need to define what is inappropriate versus appropriate use of force, the question of whether use of force is ever appropriate, and the aim that we sort of came together with was to eradicate inappropriate uses of force and to adopt the principle of least restrictiveness. So like reducing all uses of force and having a focus on de-escalation and pre-escalation. There was a lot of concern around real versus perceived risk. And a lot of the things that came up were around stereotypes of Black men. And everybody sort of felt that there was a need to go beyond the legislation, that the change wouldn't come just from having a legislative framework, but in really changing the culture in services, in mental health, in policing, to really lead to lasting change. And I just wanted to highlight a couple of the quotes that came from the focus groups. So in the lived experience one, I think it was quite striking really that we had somebody, a Black man, say that he felt that they were restraining the stereotype of him as an individual. And I think that really just builds on a lot of what we've been talking about today on perceptions and unconscious bias. And I think that's also reflected in the second quote. Our staff quite clearly felt that quick and easy solutions weren't enough, and what we actually needed was to promote lifelong learning to address all of these systemic issues. Now, drawing all of this together, I think the take-home message is that Seni's law provides a useful structure, but actual changes will require more of a lifelong cultural shift. I don't think we fully know what that change will look like yet, just because there's still a lot of work to be done. So we really want to encourage individuals and the audience to reflect on their roles as individuals, as professionals, as members of organizations, and also in wider society to challenge the issues that keep this in play. We also really need more detailed research on seclusion and restraint. As Sam mentioned, we're trying to address structural racism, and we need more data to do that, data that includes ethnicity and location and other protected characteristics. We also need to know which holds are being used, especially because so many Black men have died in the prone position. And finally, we just need to, once we have those sort of actions that we know we want to take, we need to make some concrete resource commitments. And just to say that the final report from Colourful Minds is available on their website, and I've provided a link. And we would urge everybody to look at our documentary in The Guardian called Rest in Peace, Seni. I think it just gives a really great account of the family's activism. And here are just some acknowledgements of people that we've worked with over the past year who've helped towards this presentation.
Thank you, Kevin. I think that's you've given us a challenge, and then we'll put it out there. And I want to say a big thank you to Mrs. Lewis. Your bravery, in sharing today. It's remarkable. I want to say thank you. And I think as clinicians, you have challenged us, our thinking, and also when we do approach, cases, think of the person. I think that's the first thing. Think of the person. I just want to use this opportunity to say thank you. Thank you for sharing this very difficult experience. And I can't imagine how you feel, but I do know that the first time I found out about it, it was difficult.